Welcome to the World Happiness Fest. This is the first session of the first day of an amazing week where we are going to be focusing on happiness and well-being as new paradigms for human progress. Our goal is to frame discussions not just about economic growth, but actually as about human, society, and in general community growth. So this is the main reason why we celebrate happiness around. This is happening always around International Day of Happiness, March 20th. And our goal, and this is just the beginning, they are miles away, as Shekhar will explain. Our goal is to get to 2050. If we get to 10 billion people, that's what the United Nations is forecasting, with the option to choose happiness as a way of living. We believe that happiness and well-being are the beginning and is not the end. Happier people achieve more, are more innovative, are more creative, and actually they get in trouble less. Actually, they are less violent. It's people that solve conflict in a regenerative way. So with that in mind, I just want to say thank you to Catherine for coordinating this important video conference. We're going to be talking about mental health, we are going to be talking about health in general, and we are going to be talking about coronavirus and what is happening today in the world. So Catherine, thank you so much for coordinating, and we're going to have Julian, Shekhar, Saxena joining us and explaining what's really going on in the world today. What can we do to be safe, and what can we do to actually grow from what's going on? We want to bring some hope into the conversations as well. So thank you so much for joining. And Catherine, let's go.
Wonderful. Thank you so much for that intro. And I'm really excited to be here with two of my very esteemed colleagues in mental health. They've been leaders in the space for a long time and have been really proactive too about giving out information about the coronavirus and telling people how to take care of their mental health as we deal with this change in society and the changes of how we're interacting. So we're really grateful to them for making time today to come and speak with us and talk about mental health and also as it relates to happiness. So I first wanted to give a little background on who these two people are that are joining us. Dr. Shekhar Saxena. He is he's the professor of practice in global mental health at the Department of Global Health and Population at the Harvard Chan School of Public Health. He's a psychiatrist by training. He served at the World Health Organization since 1998. And from 2010 to 2018, he was the director of the Department of Mental Health and Substance Abuse at the World Health Organization. In 2017, he received the prestigious Leon Eisenberg Award from Harvard Medical School. He's an author of more than 300 academic papers. He functioned as an editor at the Lancet series of Global Mental Health in 2007 and 2011, and the Lancet Commission on Global Mental Health and Sustainable Development in 2018. His expertise includes providing advice and technical assistance to policymakers on prevention and management of mental, developmental, neurological, and substance use disorders and suicide prevention. So we will be hearing from Shekhar first. I'm going to give you a little background as well on Dr. Julian Eaton while we're here. Again, I've worked with Dr. Eaton for quite a while, and he is also a leader in the global mental health community. So Dr. Julian Eaton is a British psychiatrist. He's co-director of the Center for Global Mental Health at the London School of Hygiene and Tropical Medicine, and he's senior mental health advisor at CBM International. His work involves promoting greater access to healthcare services, social inclusion, and realization of rights for people with mental illnesses and psychosocial disabilities, focusing mainly on poor and marginalized communities. This means working at different levels from grassroots service user organizations and broader civil society to promote participation in processes of policy and legislation development, and engaging with governments and other service providers to strengthen mental health systems and improve access to care. He's currently leading a research project integrating mental health into primary health care in Nigeria. He has published on issues relating to mental health in low-income countries and human rights. He is a member of the Lancet Commission on Global Mental Health and contributes in advisory capacity to many other initiatives, including the Movement for Global Mental Health Innovations Network, the Cochrane Collaboration Global Mental Health Group, and the WHO's Mental Health Work. He recently returned from 13 happy years in West Africa, initially in Nigeria and more recently in Togo. So we're so excited and grateful to have them both here to talk to us today again about the coronavirus, mental health, and how it all relates to happiness, and what you know, as in the general population can do for your own mental health in these days and these challenging days ahead. So grateful to have them both.
Thanks for the invitation.
So, Dr. Saxena, we will start out with you to give us some background.
Thank you very much, Louis and Catherine, for letting me join this very interesting discussion, and also at a very interesting time, although very unfortunate. We should actually be talking about happiness during all times, good times as well as bad times. And currently, when the coronavirus disease is rampant in many countries and threatening to be rampant in many other countries, I think this is definitely, if at all there was one, an appropriate time to talk about happiness and also well-being, because this is threatening not only the health of people, not only the life of people, and several thousand people are under that threat. It also is threatening the happiness and well-being of people. In fact, at a much larger scale than the figures from WHO and other agencies like CDC demonstrate, because they are covering the number of people who have either been tested positive or are seriously sick. What about those hundreds of millions, perhaps billions of people who are hearing every day from radio, from TV, from their neighbors, from mobile phones, all kinds of information, sometimes accurate and very helpful, but also in many cases, information that is false and even more threatening. Does it impact on their happiness? Does it impact on their well-being? Do they feel anxious? Do they feel depressed? And the clear answer is yes. So I think it is very timely and very appropriate that we talk about this issue in all contexts, but also in the context of current coronavirus pandemic. I would begin by saying to Louis and Catherine, to all of our listeners, that mental health is something that is a value for all of us. It's like a virtue that we need to keep in mind. It's like a value that we need to keep in mind for all our existence, all of our life. And unfortunately, we don't. We take it for granted and we bother about it only when there's something going wrong with it. Actually, we should be valuing it all the time. And it's a dimension, because mental health and well-being can be very good or also can be not so good. And the world simply cannot be divided into two groups of people, one whose mental health is good and one whose mental health, they have a mental disorder. It's just more dynamic than that. It's just more dimensional than that. We all can have at some point of time good mental health, and at some point of time we might have a bad mental health or having a mental disorder itself, and we can all do something about it. We can do something about improving our mental health even if we have no problem. If we have some problem, we can do something about preventing this problem from becoming a mental disorder. And if we do have a mental disorder, and something like between 5 to 10% of people in this world at any point of time will have a disorder, we can do something about getting it treated towards the recovery and becoming as functional as possible. And I think this message of happiness and well-being is for all people, not only for those people who have a problem, but for everybody. Just my last point, that even if we just take mental disorders, which are defined by WHO and by other agencies in a very specific way, they're extremely common. We're talking about more than 300 million people with a depressive disorder and another 300 million people with some kind of anxiety disorder. We're talking about 1 in 5 people anywhere in the world having a mental disorder at some point of time. And that's a huge figure, much, much larger than some of the other diseases that we hear so frequently about. And so whether you take the mental health dimension or you take the mental disorder as a category, these issues are extremely common. And during this time, when we are struggling with a lot of stressors, it's very important to focus on how it's going to impact, or it's already impacting our life, the life of and mental health of our friends, colleagues, and acquaintances, but also then what can we do about it? So I look forward to this discussion with this kind of introduction and open to any question that you want to ask, Catherine. Catherine,
Thank
I
you
could
so
not
much.
hear you.
Yes, perfect. Thank you so much for that introduction. I'm wondering how you see something like we know that major life events are risk factors for depression and anxiety, and I would consider this to be kind of a major life event in people's lives, the coronavirus and the kind of interruption of life as we know it. And so I'm wondering what you think the potential impacts that the coronavirus can have on people. If you could give us some thoughts.
Yep, it's already having a large impact on people, and if it becomes even more prevalent in many more countries, it's going to affect almost all of us. Just to give you a background, any major negative event in people's lives, and more especially those which affect larger populations, we are talking about humanitarian emergencies, which could be either a conflict or disaster, which many people in this world are facing every day. It could be a natural disaster, it could be a war, or in this case, like it can be a pandemic. These all have a major impact on our mental health and well-being, and the modalities as how they impact this are several. They are in the psychological domain, they're also in social domain, and in many cases they are physical. So for example, a very large number of people are being quarantined. They are being asked to remain at one place, sometimes in their homes, but sometimes in facilities which are specifically made for this, many times in the hospitals. And their freedom and liberty is being curtailed. They cannot go out, they cannot meet people, they cannot even shake hands with other people. And that really impacts our lives because we don't have a full control over our lives as we are used to having. And that's a major stress. The second important issue is the fear and the uncertainty. Can it affect me? Can it kill me? Can it affect my near and dear ones, my children, my spouse? And what will be the impact of it? And this kind of threat is always very anxiety provoking. The real threat, but also the uncertainty of it. When will it come to my city? When it will come to my neighborhood? Will I be impacted? These are all very anxiety provoking issues, and they're impacting a very large number of people. Also, there is the fact that many of us will undergo a large amount of changes in our lives because of this. We are working from home, we cannot go to the restaurant, for example, and sometimes we cannot go to the workplace and we lose our wages because many people in this world, a very large number of people, do not have a job that gives them sick leave. If they don't work, they don't get money. They may not eat. Their children may not be able to attend schools. These are real problems which millions of people are facing today. And these are all anxiety provoking. And in many cases, they lead to depression. We all have our coping mechanisms to deal with the stresses. But at some point of time, these coping mechanisms become inadequate. They fail because there's just so much stress. And this is one of those times where our coping mechanisms are perhaps not very adequate. And the result is that we feel threatened, we feel anxious, we feel depressed. In some cases, we might actually have a disorder which is called the post-traumatic stress disorder, which can be there because of severe stress in people. I will just say one more thing there. Many of us require essential medication because we take it every day. And in some cases, that medication can be because for a physical illness, some cases can be because of a mental disorder, which was pre-existing. And during these times, when the supply chains are disrupted, many people are just not able to get those medicines which they need. And that can lead to more physical illnesses, uncontrolled ones, and also in some cases, exacerbation of the mental illness because somebody cannot just get the medicine that they need every day. So these are all issues which impact us and lead to mental distress, lack of good mental health and well-being, and in some cases, mental disorders.
Yeah, that's a lot. There are a lot of risk factors and things that are going to impact our life and changes. And I think Julian's going to talk a little bit more about what we can do about that. But I'd like to just take it down a little further into you specifically. And I know you're a professor and you're teaching, and there have been some changes in your life specifically. And I wonder how you're dealing with that and what those are, and if you can share any about that.
Well, like many other people, my life has suddenly changed. In the workplace also where I am. So actually I was on travel for Harvard University, and I'm in India now. And it seems that I have great difficulty in reaching back US because of travel restrictions. But having said that, we all are asked to work from home. For example, Harvard is closing its campus for a little while and also encouraging people to take courses and teaching virtual. So actually, through the day, I was preparing my lectures, which are in 10 days' time, to convert them from a face-to-face to a virtual platform, just like the platform that we're using now. And that means a lot of work because you are constrained in not having the students in the same room. So you have to devise a lot of mechanisms to actually see to it that your teaching is effective, there is enough interaction, and students have a chance to learn as effectively as they can. So that's just one instance where our life is changing. And this is going to happen for the next few months at least, if not more. And this is stressful, obviously, because we are using new ways of doing the same thing that we were doing earlier, and also interacting with our colleagues and our students and even with our family in a very different way than we were used to. But I always look for a silver lining in all of these things, which all of us should do anyway. By learning some new techniques and learning new ways of working, maybe it will be also very useful after this crisis is over, and our repertoire of skills will actually be better. So I'm looking at that side, positive side. So it's a lot of work now, it's a lot of stress now, but I'll be a better teacher in a few months' time, and some students will be better students because they have now learned new techniques of learning. So yeah, that's where we are.
Yeah, that's wonderful. And I think, did you have your first class yesterday, or were you preparing for it?
Yes, I was preparing. In fact, we had a mock class so that we know the kind of issues that can come up in terms of the internet access and technology failing us and some people not being heard. But it worked out very well, actually. So I am hopeful and optimistic.
Oh, good to hear. That's good. Yeah, and when we talk about hope, we talk about having to create new pathways. So if our hope is that students learn and we can't do it in person, being able to adapt and find new ways to teach students is, yeah, such an important skill. So that's wonderful. Thank you so much for sharing. your experience and what's happening right now. So yeah, I would love to switch over to Julian a bit and talk a little bit more. You've done so much work in the community, and you've put out a big paper on dealing with the coronavirus in communities. And so I just wanted to talk to you a little bit about that and the importance you see of mental health in the communities and what your experiences are in your work these days.
Yeah, thanks for that. I think, as Shekhar said, it's mental health is something that's part of our lives all the time, but sometimes it's when we're in crisis that we realize what really matters. And I love the work you're doing in happiness and in hope and in really repositioning well-being as the center of what should be driving our values in community and our societies that are progressing. And I think one of the things that we see, ironically, is that even though during times of crisis like we are now, where you would think that there would be lots of distress and lots of concern, that's true, you also see people coming together. And actually, mental health is the thing that binds us in many ways. It's what enables us to live rich and fulfilling relationships with each other, to be able to function well and to be able to do our jobs properly and to enjoy our hobbies and all of those things. So those things are really important at any time. But actually, a strong and resilient community is able to come together during times of crisis. And we're seeing a lot of that now, actually. We're seeing a lot of people coming together and seeing the best of people in supporting their neighbors and understanding what their responsibilities are to keep the whole community safe and healthy. And that's something you often see, that greater solidarity and mutual support during times of crisis.
Yeah, that's great. Do you have any examples of specific projects that you're working on or involved in and what they're doing kind of on the ground? To deal with what's happening?
Sure. So I spend most of my time working in the field of international development and working particularly in lower income countries to strengthen their mental health systems and to help people with mental health problems to live flourishing lives in communities. One of the things that we've found in previous crises, like the Ebola crisis in West Africa and others, is that actually doing that work all the time and helping to strengthen those systems and the places that people can go in advance is really important when things become difficult, because people need that. And if you've already done, for example, a lot of training good community health workers, then they're available when people need more care. So that kind of work in advance is really important. One of the things that we're finding now, of course, which as Shekhar mentioned, is that everyone's restricted, that it's more difficult to travel. I've just been told that I should not be also going in to teach or to be doing any international travel, and that makes it more difficult to support people. So it's definitely affected our work, but one of the things that we really focus on is making sure that as much as possible, we continue to support the most vulnerable people. So we know that the great majority of support that people get is from the people around them and from their friends and relatives and neighbors. And that's fine. But my work tends to be with people who have more severe needs, either with mental health problems, psychosocial disabilities, or actually people with all sorts of other disabilities. And for those people, it's really important that we make sure that the systems that they rely on don't fall apart. So we, for example, want to make sure where there are good messages coming from the government or from healthcare providers, they also get to people who can't see and people who can't hear and people who are at home because they find it difficult to leave their home. So one of the major shifts for us during a time like this is really making sure that people aren't left behind, that more vulnerable people are as able to benefit from good advice, maybe getting access to testing if that's necessary, or being able to get care at home if they usually do, even during a time of crisis. So it really has affected us. But I would say that, as Shekhar said, during times of crisis, it's worth looking at the silver lining. I think one of the things that's really struck me actually has been we have been seeing climate change as an increasingly important issue to grab hold of. And we are very rapidly learning how to do our work without lots of travel. So that for us as an international development organization, where international travel is important and communicating with people in many parts of the world is important, we're starting to learn maybe about how we can do that better and how to preserve our planet better.
Yeah, that's a great point. Yeah, air travel has a big impact on climate change. So finding new ways, and when is it really critical to meet face to face, and when can you do it virtually? I think that's, yeah, an interesting point. In terms of psychosocial support and what we can do to help other people, do you have suggestions for how, you know, as individuals we can engage and support people as we go through this crisis?
Yeah, I think there's things that we can do as individuals. I think probably we're able to be really important and impactful on the people immediately around us, and sometimes a bit further afield. As I said, we know very well that the great majority of people are actually quite resilient and able to find support and solutions from people around them. I think that's helped if they've been thinking about their well-being. Some of the work you've been doing on hope is important for that, for people to actually learn how to be better at coping. You know, that is something that, as you say, you can teach. But people generally are pretty good at that, and we see the best of people during times of crisis. But there will be some people who don't find that support from people around them, or their anxiety or concerns and worries are more than can be alleviated by people around them. I think it's really important that as we seek help beyond just the people around us, we seek good advice and good information. One of the worries about social media and the wide access to lots of information now is it's not all of very good quality, and people need to be really careful to make sure that they don't expose themselves to lots of very frightening messages, some of which might not even be true or imminent for them. I know that you're going to share some good links for some good places to get advice, but that's the first thing, I think, is not to worry ourselves unnecessarily and get advice from sensible sources. I think where our local communities, or sometimes our, you know, the local services that are available to support us are not able to do so, in some countries, some additional things have started to be put in place. So, for example, where people might have generally gone to try and see a counsellor or a psychologist or a therapist for more support, then that really needs to start shifting towards some of the helplines, for example, that's in some countries, and many countries are now being put in place. And sometimes they are linked to helplines where people would phone if they have concerns about their general health or in relation to coronavirus. They can also get counselling support and emotional support from there, which is the best thing, of course, that those things are really well integrated, because our emotions are a part of our overall health. So it makes sense for that support to be available from those same sources. Equally, some people are either already linked into specialist mental health services or community mental health services because they use them already, or they need to access that greater level of support because of how anxious and stressed they're feeling because of the coronavirus. And I know that in many countries, there's been a lot of thought that's been put into how those services have been adapted to make them still accessible to people where they can't use the usual processes of coming to an outpatient clinic and sitting together, you know, for example, to wait to be seen, or even to be having group therapies. So I think many of those slightly higher level of sources of care have also started redirecting themselves. But I think there are places that you can find advice in many countries if you need that extra level of support beyond what's available from people around you, or just the kind of counselling you might get from those kinds of helplines. I think it's really important to remember that there will be people who need more intensive support. For example, people, as Shekhar said, who rely on medication. You know, if people actually really need their medication to stay well, the worst time that you could run out of medication is when you're having all these other worries as well. So that I know that it's can be very difficult, but making sure those medications are available and asking in good time for people to help you to have a good supply, I think is really important. And for those people who are providing services, we really need to be thinking, who are the people who won't be able to easily access the kinds of care that they would normally do so, and make quite strategic efforts to make sure that those services are available to those people who will really be needing them. I think the other group of people we need to think about are healthcare staff, and people whose job it is to look after people who might have coronavirus, because they are actually at much higher risk of catching that themselves. It's an infectious disease, and if they're meeting a lot of people all the time, there's a risk that they will get that, and that naturally makes them more anxious, more likely to be concerned about their own well-being. So it's really important for healthcare service providers to make sure they think about their staff, that they give them some time out from frontline work that is very stressful and difficult. Make sure they have opportunities to spend some time at home when they're not, constantly under stress. And we know from what's happened in China and many other places that actually many healthcare workers have made great sacrifices and sometimes got sick themselves. So we really need to make sure that those people in particularly stressful jobs are able to look after their well-being. You're no use to anyone else if you're not well yourself, emotionally or physically, and taking risks isn't a good long-term strategy. So I think the other thing to think, just in closing really, is that this is a temporary situation. It's stressful and it's difficult, and it might be difficult for a while to get the kind of care you really need, but actually we know we're talking about a matter of months. And even more positively, we've never seen the healthcare sector, the pharmaceutical sector, kick in so quickly to get really rapid solutions, getting vaccines through more quickly than ever before, antivirals, and certainly getting health systems robust to get ready for maybe if this becomes a permanent part of our human experience of having coronavirus around for a long time. So there is a lot of hope. There are a lot of things that we know are going to change. It's a difficult time, no question, but it won't be forever. And it may be difficult, inconvenient, but we really need to do the right thing for the community, to self-isolate if that's the right thing to do, because it's our responsibility to look after each other, but to know that it's not going to go on forever, and that actually we will be able to get back to our normal lives again.
Yeah, that's wonderful. That's super helpful. I know, and for me personally, I am ramping up. I mean, in times of stress, for me, I know I have to exercise, I have to meditate, I have to watch what I'm eating, really take care of the things that impact how I feel and my mental health, connect with others, even if it's online, not isolate during these times, talk to my therapist if I need to, look at meditation or medication if I need to, but it's, so important. So this has been really helpful. Thanks. Louis, do you have any questions for them? We lost him. He's back.
No, I'm here. Yes, actually, this is super helpful, and I find so much hope. I have a couple of questions more focused on facts, so we can understand a bit why this trend of fear is going so fast around the world. Because if we look at the current situation with influenza and with flu, we know that as of today, there are around almost 700,000 people dead. If we look at coronavirus, it's less than 4,000. So we are talking about 700,000, we are talking about 4,000, and however, nobody talks about flu and influenza, and we keep talking about coronavirus. So can you explain why this is happening? Because many people don't get it.
Luis, I will take first shot on that. I think you are right that the fear is spreading faster than the virus. In fact, WHO called it the infodemic, as opposed to the pandemic, because there is correct as well as incorrect information that is reaching people much faster. But remember that this is a new virus. So human beings don't have the immunity to this virus, although influenza has been around for a long time and people have developed immunity. And also there is a vaccine, as Julian mentioned. There is no vaccine for corona. So this is new, and we are relatively unprepared for this kind of virus, even biologically. But psychologically also we are unprepared, because it arose suddenly and it spread very quickly and killed a number of people. So it is the velocity and not the actual extent of problem. It's the speed of the problem that is more threatening. And then there is the effect of information spreading much more widely because of our rapid ways of communication. Earlier, 20 years back, we did not have such a rich social media or such a rich internet communication. But now, within minutes, within seconds, people get the information from wherever it is arising. So it does impact on the threat, which is continuing changing by seconds and minutes and hours, when earlier this was not so. You waited for next morning's newspaper, but now you wait for the next tweet or the next photo. And that in a way can be reassuring, because you know you're connected, but in many cases and for many people, it can be even more threatening. So I think there is a positive and the negative side of it. But yes, you are right that we need to be thinking about it in a proportionate manner. And maybe we are more fearful than we should be. I'm not saying that we should not take precautions, but we should not be too fearful of this. As Julian said, my colleague and friend, this will pass.
I think I would add to that. The infodemic is real, and it's a positive thing in that it shares information in a very quick and comprehensive way. But we do need to worry about the risk that it overemphasizes certain things as opposed to what the real risks are, and makes people suffer emotionally. One of the things that I've seen that's so different and positive about this occasion is that well-being is at the front of the agenda throughout, whereas historically we would have had a lot of focus on biological elements of response. People are thinking about well-being now, and I know that it's one of the considerations very carefully, in very carefully crafting messages and communications to make sure that there isn't overly dramatic messages that will cause more harm than good, by recognizing that actually people's emotional state and well-being is not only important because it can make them behave in negative ways, like going to panic buy or to go to hospital unnecessarily, but also that it's itself a good. It's good for people not to be too anxious, and so I recognize, it's really important for media actors to be responsible. It's really important that we ourselves are responsible in what we retweet, but we also need to recognize that I think the acknowledgement of emotion as an important outcome in this is much more than it has been in the past, and I think that's a really positive thing.
I have a probably final question, and it's actually for you three, Catherine, Shekhar, Julian. You all work in international organizations. You know how relevant leaders are, and this is a two-part question. One is, what is the role of leadership when we come into this situation, and especially conscious leadership? The second one, and there are so many comments on the street around this is managed by a small number of people. Are you being in, and you are in international organizations? So the second question is, can this really be managed by a small number of people who want to create a new state of a organization in the world. Is this possible at all? So it's more, the second is more about conspiracy theory, is more about, can this really be managed by a small number of people? And the second one, and the first one is, what is the role of leadership, unconscious leadership in this space?
Luis, I will definitely answer to the first part of your question. I think what we need is responsible leadership at all levels. International, national, and very local, within your own community. We need that kind of responsible leadership so that the risks that we talked about earlier of misinformation, misconceptions, excessive fear and anxiety can all be decreased, and also adaptive measures which are positive in terms of physical methods of prevention as well as reassurance in terms of the support available can be at all levels and can be given at all points of time by people who are responsible. And I'll give you examples. At an international level, organizations like WHO and also UN itself are playing a big role in providing timely and correct information, which is a show of responsibility. At a national level, the health agencies as well as the top leadership of the country, the political leadership, is providing that kind of information. And as Julian said, this time it has been much more quick and much more clear and acknowledgement of the well-being and the happiness of people and taking precautions. So I think that needs to be encouraged. And obviously the misinformation needs to be discouraged by the responsible leadership so that they can contradict and already say their piece on what is the right way of reacting and what is the wrong way of reacting. And it also inculcates in people a sense of support that my leader is with me. And so I have somebody to fall back on in terms of practical needs, but also in terms of information and support. So those are all very, very essential. And we can all play a role in that, in whichever capacity we are. Me as a teacher and a health care professional, you as a person who people rely upon for correct information, and religious leaders, local leaders, political leaders, we all need to play that role. I think in this kind of pandemic and an international humanitarian crisis, we need to leave aside our sectarian interests and work towards the benefit of people. So that is something that is extremely important. And thank you for raising that point.
Thank you.
Maybe I can say something about conspiracy. I think obviously times of worry and anxiety and sometimes multiple confusing messages are very fertile ground for conspiracy. You can see why it happens. But in many ways, this isn't a surprise. We've been waiting for a global pandemic for some time. They happen every 80 years and we're overdue. We are living in a world of very easy, almost ubiquitous travel across multiple countries very easily, very cheaply, which is just very likely to cause this very rapid spread of any infections which 100 years ago would have arrived and disappeared within a small space of time within a village, So it's not surprising this is happening, but I think we do need to recognize the importance, again, of media and of leadership. One of the things that we know is really important is trust. That there have been a number of problems in previous infectious disease epidemics, for example, the Ebola one, even in attempts at eradication of polio, where there wasn't the trust in even the health workers who are attempting to support people, or in vaccination, for example. And if people don't get good information, if they don't see their leaders as trustworthy people, it will encourage this kind of conspiracy. But it's not good for the population. We need people who are together, understanding sensible common messages and behaving responsibly. And if there are conspiracies allowed to flourish, that undermines that and actually is very dangerous to life. More people will die if people are not behaving responsibly, in terms of very practical advice given to them, like hand washing or maybe a vaccination when it comes along. So we need to be very careful about it. I think it's not a surprise that it happens, but I think that the science is good about what we need to do, and we need to take it seriously at the moment and get this over with as quickly as possible.
Yeah, and I think I would add just to both of that, I think it's really important that our leadership really own the feelings that are associated with what's happening. So the fear and acknowledging the fear. I mean, oftentimes leaders don't address these negative emotions, and yet they act out on them. And I feel like what we don't address follows us. So acknowledging that we may have fear and sadness and these different things related to what's happening, but then still leaving space between that fear and action. So getting ourselves and having our leaders getting themselves back into a more positive emotional state. And then taking inspired action from that. So taking informed action. When we act out of fear, which I think we're seeing in some leaders, we don't take inspired action. It's in an uninformed action. And so I think, having our leadership address those negative feelings, which they often don't, is really important and shows compassion and connection.
Well, thank you so much for leading with hope and with responsibility, and really being role models for everybody to really follow. So thank you so much. We are going to share many links together with the video, so everybody can access to the latest information from the World Health Organization, WHO, from so many different institutions. So people really have the right information, the right facts, and the right techniques and solutions to navigate, hopefully, this temporary situation that we are going to live over the next couple of months. Thank you so much, Julian, Shekhar, Catherine. We keep going with many other interviews today and during the week, but I'm so happy that we can kick off the whole week with the elephant in the room. And in this case, with this infodemic, together with pandemic that we are living. Thank you so much.
Thank you very much.
Thank you very much, Luis.
Thank you.